media reports that the rates of tuberculosis infections are rising for the first time in nearly 20 years, and the evidence points to people coming from overseas to the United States. Our own investigation has found that everyone, U.S.-born or foreign-born, who lives in a refugee resettlement area is at risk for contracting tuberculosis.
The Centers for Disease Control reports refugees are not required to be vaccinated before coming to the United States. Tuberculosis being brought by refugees to the U.S. is an issue the Minnesota Department of Health is working to fix. It's the leading cause of death from infectious disease worldwide.
And the most common risk factor being from a country where TB infection is widespread. Nearly a quarter of all TB cases in Minnesota last year were from people from Somalia. As our investigation progressed, we found that many people in Fargo don't actually know a whole lot about the disease.
Valley News Team's immigration and relocation reporter, Bradford Eric, has been looking into what this means for your health.
Documents obtained by the group Judicial Watch in April contained this email from the CDC. We might as well plan on many of these kids having TB. It's from a 2014 operation where top federal health officials were sent to the southern U.S. border to stem the tide of unaccompanied alien children crossing into the U.S. Tuberculosis is caused by bacteria that primarily affects the lungs and is then spread through the air. The Minnesota Refugee Health Quarterly from April of this year. Page 3's headline, TB continues to affect refugee communities. There's even a pie chart breaking down all of Minnesota's 150 TB cases. Over a quarter were from Somalian refugees. Now to North Dakota, where there were 9 active cases in 2015, 6 of them here in Cass County. But there were 355 latent TBI cases reported. Latent TB, or LTB, it means you're infected with the TB bacteria, but your immune system is able to contain it. You show no signs of actually being sick. But according to the North Dakota Department of Health, if you get run down, get a severe cold, that bacteria could become active again, making you a threat to infect others.
I don't know if it's a big enough deal to panic, but maybe just some screening or maybe some precautionary measures.
Maybe we could set up some sort of vaccination right at the borders, so if they want to come over, then we can vaccinate them, help them right off the bat, you know.
The North Dakota Department of Health also says many cases go unreported. A CDC official said days ago that across the board, screening is not recommended for everyone coming to the U.S. Along with the CDC, an article in the New England Journal of Medicine says those who are screened overseas and who show abnormal results are forwarded to local public health departments, where the refugee is only encouraged to follow up. But over a quarter of those referred for follow-up just don't show up, and there's nothing requiring them to undergo treatment. I pressed the North Dakota Department of Health if the active and latent TB cases were from refugees. They replied that they, quote, don't have that information, but they track where the infected individual was born in an effort to prove that the majority of cases are from foreign-born individuals.
I think it's better to do a good screen. Make sure everybody has that vaccination to spread that disease.
Charita Hetiarachi says he and his family had to undergo many vaccinations before coming to the United States years ago, but he wasn't sure about TB, and he was surprised when I told him about how deadly it is worldwide, describing the threat it poses to the Fargo community. I reached out to Lutheran Social Services of North Dakota, the resettlement agency running the operation in this state. I asked if TB is a threat to refugee populations and the general public, and if the Department of Health is targeting them for the job they're trying to do. They replied in part that, quote, we know active TB condition is an inadmissible condition to enter the United States, and all of our refugees are properly screened prior to the admission. We do not see active TB as a health risk. LSS specifically singled out active TB in their response, despite the CD and state health agencies reporting latent TB as an area of concern. Does this mean you need to run out and get a TB test? Apparently one East Coast doctor thinks so, as one viewer told me their doctor insisted on a test since Fargo is a resettlement area. It probably wouldn't hurt, and the more informed you are about your own health is never a bad thing. Furthermore, this story has ignited much discussion on our social media sites. Many of those criticizing my reporting are not even from the viewing area and may or may not be affiliated with organizations pushing an agenda. Mike, Andrea.
Okay, thank you, Bradford. We've put links to information from the CDC, the North Dakota Department of Health, and other sources Bradford found for this story.
We've also linked back to the survey we commissioned in November to gauge your opinions of continued refugee settlement in the area. Just visit valleynewslive.com and click on this story.